Everyone, last lecture you will see about Medicinal and Toilet Preparation Act 1955 and its rule 1956. Today I deliver the lecture on Unit 5 in that Code of Pharmaceutical Ethics. Firstly, you know about the difference between laws and ethics. Laws, it is an authorized instrument that rules over the society. Also, law can be prevent the illegal practice of pharmacy and it can be prevent the sale of substandard quality of drugs but cannot prevent selling of a drug at cheaper rate. Then ethics, it is the way of conducting life laid down by the society to help the individual to decide what is wrong and what is right. And it can be prevent unethical practice of pharmacy that can be a cause grave risk or dangerous to the life of individual or patient. Then its sale of substandard quality of drugs and at cheaper rate is restricted by code of ethics. Now let us start with the our topic, that is a code of pharmaceutical ethics. What are those codes? Let us see. First, introduction. Ethics is the science which deals with the study of moral duties and it is a concern with the human conduct and characters. It is the wrong or right human behavioral codes of ethics is carefully formulated set of principles for guidance of the particular groups or members of a profession. It is a very important that it is the wrong or right to give the behavioral codes of ethics is carefully formulated set of a principle for a guidance of particular groups of member of a profession. You know about difference between laws and ethics. Then Code of Pharmaceutical Ethics is designed by a Pharmacy Council of India. It is a guide to the pharmacists regarding how to behave in society. That is with the patient, public, and his colleagues. Then the pharmacist is a vital link between the doctor and patient. He is responsible to provide a professional service of a high order to the community at a large by ensuring production of a quality medicine and it is sale distribution to the consumer, there safeguarding the health of the public. Code of Pharmaceutical Ethics is designed by Pharmacy Council of India. It is very important things. It asks in the MCQ, Code of Pharmaceutical Ethics is designed the Pharmacy Council of India. Okay. Then it guide to the pharmacists regarding how to behave in society. That is with the patient, public, and his colleagues. And it is the pharmacist is a vital link between doctor and patient. He is responsible to provide professional services of a high order to the community at large by ensuring production of the quality medicine and its sale, distribution to the consumer, thereby safeguarding the health of the public. Now it divides into following four subtypes. First, pharmacist in relation to his job, pharmacist in relation to his trade, pharmacist in relation to medical profession, pharmacist in relation to his profession. So you will discuss one by one in detail. First, pharmacist in relation to his job. How to behave the pharmacist in relation to job? First, scope of pharmaceutical services. Scope of pharmaceutical services. Pharmacist who is engaged in hospital pharmacy should supply the medicine correctly and properly. He should supply the medicine efficiently without delay. More can should be taken during emergency supply. It is very important that this pharmacist should be provide or supply the medicine efficiently without delay. In emergency cases, it not allow the delay for the patient safety. Scope of pharmaceutical services. It is the first thing, that is a pharmacist who is engaged in hospital pharmacy should supply the medicine correctly and properly, and he should be supply medicine efficiently without delay, and more care should be taken during emergency supply. Then second, conduct of pharmacy. In a pharmacy section of a hospital pharmacy, pharmacists prepare the medicine according to the prescription of physician. During the compounding, he not make error as to medicine if dispensed wrongly may not be give the necessary relief to the patient from disease. On the contrary, there may be some undesirable side effect. The pharmacist in uh, starting pharmacy profession, the pharmacist will be prepare the medicine according to the formula given by physician. During this compounding, he not be make error as to the medicine. If the dispense wrongly may not be give the necessary relief from the patients. It is a very important thing, that is will be not give the wrong or error in the medicine dispensing, and it also be give the not give the relief to the patients. On the contrary, there will be some undesirable side effect. It is the conduct of pharmacy. Then handling of prescription. As the prescription given by the physician are presented to the pharmacist for dispensing, pharmacist is supposed to be maintain its secrecy and should not make a comment on it. Any of the patient coming to the pharmacist, the pharmacist not give the any comment on it about disease, about disorder. So it is a very important thing. As to the prescription given by the physician are the presented to the pharmacist for dispensing, pharmacist is supposed to maintain its secrecy to the physician. It not give any comment, not give any response about that prescription. He should read it carefully. It is a very important thing that it will be read carefully and then decide what is type of medicine is required to prepare. No any additional omission or substitution of ingredient should be made without the consent of the prescriber. If there are some error is does not, he should be correct himself. He should consult to the physician. It is important that he should be read it carefully and then decide what type of medicine is prepared, and no any one omission or substitution of ingredient should be made without the consent with the prescriber. If there are some error in dose, he should be corrected himself. He should not correct himself. He should consult to the physician. Okay, it is for today's lecture. Next lecture we will see about remaining part of Code of Pharmaceutical Ethics. Now today we will discuss about difference between law and ethics, introduction of Code of Pharmaceutical Ethics. In introduction, ethics is the science which deals with the study of moral duties and it concern with the human conduct and character. It is the wrong and right human behavior. Code of ethics carefully formulates set of principle and guidance to the particular group of member in the profession. Code of Pharmaceutical Ethics is designed by the Pharmacy Council of India. It guides to the pharmacist regarding how to behave in society, that is with the patient, public and his colleagues. The pharmacist is a vital link between doctor and patient. He is responsible to provide professional service in high order to the community at large by ensuring production of quality medicine and its sale distribution to the consumer thereby the safeguarding the health of the public. Then you will see about the sub type of the division. First, that pharmacist in relation to job, pharmacist in relation to trade, pharmacist in relation to medical profession, pharmacist relating to his profession. And today I will start the first point, that is pharmacist in relation to job. In that, scope of pharmaceutical services, conduct of pharmacy, and handling of prescription. It is for today's lecture. Next lecture you will see the remaining part of this chapter. Thank you.